So here is the shoulder blade. This is obviously for the right side, not the side I'm working on. I can demonstrate it on me. You can see the collarbone and the supraspinatus, infraspinatus. And then on the underside you can see there's just as much muscle. Now, what we're going to do with this tool is be able to slide up into this subscapularis and work all of this. Obviously we can also work the teres muscle there. Then we'll go over and we can slide in here. And it doesn't show it on here, but the levator scapula inserts actually, again this is the anterior side. The ribs would be right here. So these muscles are right next to the ribs. And people with frozen shoulder, fiberglass have laid down and this is stuck right to the rib cage. So you need to be able to get in there and release that. Now, if you have been working underneath into the subscapularis, which I presume you have been, you know how difficult that is on your thumb on most people. Fortunately, Kate is much easier, but that's where the spoonbill tool comes in. It is just a dream come true. You can slide up underneath there, just like that. You can vary it. You can see her scapula nicely here.
So it's really good for me, especially that spoonbill. I had never had that worked on me before, and it felt really good. And you know, in the subscap, I was always so afraid to have somebody. It was hard enough and painful enough when they went in with their fingers. But actually, it was nicer with the tool because it was gliding better. You know, it wasn't as painful to me. But, so yeah.
The tool doesn't have any fingernails.
Yeah, I mean, they are.
That's a big thing for subscap. Of course, on many of your people, you won't be able to do this right away. You'll have to sneak in much more slowly. And now my intention is to push up into there and also to put pressure laterally and superior. So I could, on some people, even put my hand, that's why I made this handle longer. This way I can actually kind of use this as a fulcrum to put extra pressure into the underside of the shoulder blade. And of course, if somebody's very sore, you may just sneak in there and stop and hold. On Kate, I think she's feeling it a little bit, but I can actually move around in here pretty nicely. On one of the videos I have on YouTube, there's a student with a frozen shoulder that she's a student at a school, and the person working on her is a student at the school, and they were able to get up underneath that shoulder blade better than they ever had on the initial try. Now you can also use this, just let your elbow drop down. Good. See how this popped right up when her elbow came down? Now I can get underneath the vertebral border of the scapula, get way underneath there. I can sneak down underneath that inferior border. You can see that I can get way up there. So those people with frozen shoulders, you can now clear all that out without destroying your thumbs. This is so easy to do. Right there, it's a little harder to push in because we've got the border of our upper trap right there as well. The tissues are more dense because we're getting some trap fibers. So it's a little harder to push through them. An even more effective way on some people to do this subscapular work is to do it with the person on their side. It's a more advanced way. Turn Kate on her side, and in order to get into that shoulder blade, we're going to have her use their lower arm to support the upper arm. And this way we can bring that shoulder blade way off of the body. Now, bring that shoulder blade as far off of the ribs as possible so we can sneak right up in there. Now, if I was standing, I could be pulling her arm towards me. If she was quite sore, I might need to keep it because she would want to retract it, so I couldn't get in, and I would gently coax her to leaving it out so I could get at it. And I could work through this oh, there we found a sore spot. So we actually are getting into something in this position that we couldn't get the other way.
Like I just kind of assume that you know a lot about using the tools. And Linda, you mentioned yesterday that you had a lot to learn, but do you use them regularly? And Kristen?
Since I'm in the spa now, I haven't really, but after having it worked on me, you know, I guess you feel like the person's going to know it's a tool, but it really doesn't feel any different. So what I'm saying is I think I can...
If you don't tell them,
Right,
they might not
yeah.
even realize it.
Yeah.
After practicing yesterday, I'm totally comfortable using them at the
Okay.
spa now, whereas before I don't know, I just, I didn't know how to incorporate that. I guess.
And I use some tools, but Meryl always goes into my room and says, "Oh, this is such an old one." Well,
Yeah.
you know, I don't have.
She
the
never
new
buys
ones.
the new revisions.
So just like anything, I utilize the tool that I have, and I learn to use it in all different ways. But especially that spoonbill, I had never had that worked on me before, and it felt really good. It was hard enough and painful enough when they went in with their fingers, but actually it was nicer with the
And it's not pokey.